Thank you very much, Dr. Ezike, and I want to begin today by bringing your attention to the charts that are here to my left, reflecting how each of Illinois' 4 regions has fared in meeting our Restore Illinois metrics. All of this data is updated every day for you to track for yourself on our IDPH website, dph.illinois.gov/restore. But I wanted to bring the May trends to your attention in recognition of the end of Phase 2 for all 4 regions of Restore Illinois. As you can see, each of the 4 regions has hit the 3 requirements for moving into the next phase: at or under a 20% positivity rate and increasing no more than 10 percentage points over a 14-day period, and no overall increase, so stability or a decrease, in hospital admissions for COVID-19-like illness for 28 days, and available surge capacity of at least 14% of ICU beds, medical and surgical beds, and ventilators. Starting tomorrow, all areas of the state are eligible to reopen in accordance with Restore Illinois Phase 3, which offers specific guidance on how things like outdoor dining, outdoor recreation, manufacturing, retail, personal care services, and offices can move forward with safety measures in place. All of that is available on the Department of Commerce and Economic Opportunity website, where you can find it at illinois.gov/business guidelines, illinois.gov/business guidelines. I want to let parents and kids know that we have provided guidance to day camps and youth sports to allow the return of those activities for children across the state. Summer activity is so important for overall health, and the doctors have given instructions for counselors and coaches so that summer programs can be restored with safety measures. Later today, we will also be posting recommendations for houses of worship, providing more guidance for houses of worship in Phase 3. Having received many plans and ideas from responsible faith leaders, IDPH has reviewed many detailed proposals and has provided guidance, not mandatory restrictions, for all faith leaders to use in their efforts to ensure the health and safety of their congregants. This includes suggestions on capacity limits, new cleaning protocols, indoor gatherings of 10 persons or less, a reduction of activities like sharing food, and the safe conduct of outdoor congregating. The safest options remain remote and drive-in services, but for those that want to conduct in-person activities, IDPH is offering best practices. Additionally, with Phase 3, horse racing will be returning to Illinois tracks, boosting the industry in a key season, especially for thoroughbred and harness racing. The Department of Agriculture has worked with the IDPH, with the Illinois Racing Board, and industry leaders to develop guidelines for racing, allowing those whose livelihoods depend on these races to get back to work, and allowing spectators to watch from home and place wagers online and over the phone. And while it's still at least a few weeks off, I want to affirm that the 3 metrics that have brought us from Phase 2 to Phase 3 will be the same as those that will move us into Phase 4. Just as this 28-day period of tracking started when we moved from Phase 1 to Phase 2 on May 1st, our next health metrics calendar will restart tomorrow and run for the same period, meaning that regions that meet the metrics could move into Phase 4 possibly as early as Friday, June 26th. That's the earliest possible date, and we will be watching the metrics closely in hopes that we will move forward expeditiously. But our goal is, and always has been, to keep people safe from this coronavirus while we restore more of our normal activities. So it's important that we remain careful about continuing to wear face coverings, washing hands, maintain 6 feet of distance, wiping down surfaces, using hand sanitizer, and other mitigations. Let's not move backward. but instead, let's move forward together. Because Restore Illinois is a plan that has 4 regions, Northeast, North Central, Central, and Southern, we will restart our tracking of the data for each region beginning Friday. As always, individual townships, counties, municipalities can choose to operate on a stricter schedule and with stricter metrics. With that, I'd like to talk today about long-term care facilities, which have been at the center of our COVID-19 response since day one, and which will continue to be a central focus of our work especially as we safely reopen sectors of our economy. The overwhelming majority of long-term care facilities in Illinois are privately run. In response to the COVID-19 crisis, some of those facilities have acted proactively, some only reactively. CDC guidelines have provided those facilities with the roadmap for managing infection control through this crisis. But at the state level, we've gone beyond CDC guidelines to provide free testing of residents and staff by our IDPH nurses, consistent communication of best practices, and individual facility consultations with infection control experts. And we have delivered PPE to every nursing home in the state and to all counties with long-term care facilities. Of our roughly 1,100 long-term care facilities that care for elderly Illinoisans, over 900 have been connected with directly and in person by the IDPH Office of Healthcare Regulation, IDPH consultants and coordinators, IDPH's teams of nurses, or members of the Illinois National Guard. That includes visits to provide help with testing or staff PPE training or support for existing staff to administer tests or a whole host of other supports. Our IDPH consultants and coordinators interact regularly with the statewide network of 97 local health departments, which remain the front line of communication and support for private long-term care facilities in all elements of our COVID-19 response. Our state's response teams going into nursing homes have evolved over the course of this pandemic, so I want to bring you all up to date. We now have 2 groups of nurses fanning out to long-term care facilities around the state. One group of 200 IDPH nurses who are doing focused COVID-19 infectious disease control surveys to monitor compliance, and who can also conduct swab testing, train existing staff to take specimens themselves, and review and improve each facility's PPE use and hygiene practices. And a second group of 100 contract nurses, which we doubled at the end of April, who are also monitoring for infection prevention and control, but also providing additional testing assistance. We now have 10 teams averaging visits to 2 homes a day each, potentially as many as 140 a week across the board. Those teams are ensuring best practices to keep residents safe and helping test residents and staff for facilities that have requested assistance when they cannot manage it themselves. Some long-term care facilities opt out of the free assistance of IDPH's response teams, sometimes because they choose to take their own specimens using IDPH swabs, or because they choose to work with their county or city health department instead. Others work with their local hospitals and health centers to source and conduct tests. To date, we've sent about 45,000 testing kits out in 200 shipments, up from 18,000 swabs to 68 facilities back in late April. Still others have declined the free visits and even the free testing supplies from IDPH entirely. As I've explained, these are largely private entities, and even as we work to ramp up regular testing of all our long-term care residents and staff, my administration has received some pushback from owners and industry representatives, making it difficult to secure compliance across the board. As a reminder, from the beginning of this crisis, we've put our long-term care facilities, and especially our nursing homes, among the highest priorities of our COVID-19 response. In the earliest days of March, we implemented strict protocols at our state-run veterans homes and congregate care facilities and provided similar guidance to the hundreds of privately owned facilities statewide. And at our March 5th briefing of the General Assembly, we offered copies of those recommendations to all state legislators to get their help in instilling a sense of urgency in long-term care facilities in every corner of the state. Many facilities have been great partners, and they should be applauded. But long-term care residents are some of our most vulnerable Illinoisans. That's why strong compliance from many isn't good enough. To counteract any heel-dragging at any privately held nursing homes, the Illinois Department of Public Health is today filing a rulemaking requiring each facility to develop its own individualized testing plan and document an established relationship with a testing lab, whether it's a commercial lab, a local hospital lab, or our state labs. This new rule will require nursing homes to conduct testing when experiencing an outbreak, when an outbreak is suspected, periodic testing even when there is no sign of an outbreak, in line with new federal guidance issued this week, or when directed by IDPH or their local health department to do testing. The rule also mandates compliance with infection control recommendations at large. Test results should be used to identify asymptomatic cases, to confirm infection in symptomatic cases, to evaluate quality indicators, to follow up on infection control programs, and to support decision-making. To be clear, this rule doesn't deviate from our existing priorities, but it gives IDPH, a regulatory agency, additional teeth in securing buy-in from these private entities. Administrators who decline to provide a testing plan will be found in violation of the rule. The challenge of protecting elderly Illinoisans who live in congregate settings, many of whom have underlying conditions, is evident in the heartbreaking percentage of illness and death that have been seen nationally in LTC facilities. COVID-19 is unrelenting, and it has visited its worst effects on older Americans. But our state will continue to use every resource at our disposal and the collective medical experience from across the nation to protect our seniors throughout this crisis.